Hello, welcome back to the Love channel, and I'm Rosie. Okay, so this is part 2 of series 1 of borderline personality disorder. And in this series, we're going to be looking at the symptoms of borderline personality disorder and how it is diagnosed as well as its treatment. Okay? Alright, so according to DSM, which is the Diagnostical Statistical Manual for Mental Disorders, in the fourth edition when it was revised, basically it stated that for borderline personality disorder to be diagnosed, there must be at least 5 of the following symptoms that I'm going to list. In all, it's 8 that I have right now, so we must have at least 5 of these symptoms for an enduring time, Okay, so the first one is there is extreme reactions, whether it's be rage, depression, abandonment, and panic, any sort of extreme reactions. And then the second thing there would be a pattern of intense and stormy relationships. Yep, I know how that could be. Third one, this would involve distorted and unstable self-image. You know, how you look at yourself and that sort of thing. Like, let me use an example. Like somebody would take me as beautiful and all those good stuff, while I'm like, what? Are you blind? Because when I look in the mirror, I will see that, you know. So it could be like that. And the fourth one, this would be a chronic feeling of emptiness or boredom. And the fifth symptom would be impulsive and dangerous behavior such as self-harm. I mean, how that can be. And it could also be like going out on a spending spree, going and doing any reckless behavior, really. Okay, the sixth one would be intense and highly changeable moods, and these moods will last for let's see, for a few hours to a few days. And we are on the seventh symptom. This involves inappropriate or intense anger or problems controlling the anger. And before I used to have that problem like really, really bad, but I believe that now my anger is not so bad as before. For sure, it's not as bad as before. So as I said, it does get better. Okay, so we're on the eighth symptom, and the eighth symptom is having stress-related paranoid thoughts or severe dissociative symptoms. And dissociative symptoms, this is like involve like when somebody feels like they're outside of their own body, when they feel like they are outside looking in, and they're watching themselves doing things that they don't want to do, and that sort of stuff, and feeling like what's happening around you is not reality. Okay, so we're that's the 8 symptoms really. So now, one thing I want you guys to know is that people with BPD may feel like angry and distressed over the minor separations from people to whom they feel close to. I know I have that kind of problem. Yeah, and I remember one of my friends saying that, that they would cry and support when their mom had to leave and support, only because they just want to be around them. And I totally get that, because in different situations, that's how it is as well for me. Also, people with BPD may self-harm to help regulate like their pain, so that it helps us feel like we are in control, really, of our pain. What else? They do it to punish themselves as well as to express their pain, and that in itself, for me, it's like all 3 of those that I just mentioned, mostly for expressing my pain, Even though, guys, I'm not promoting self-harm, but I'm just being real and honest with you that I do self-harm and I am in recovery trying to stop, but just explaining how it really is. And so it's like if I have a whole day of stress and so forth and all those things are on my mind and are bothering me, then I would keep it to myself and so forth. And then when I get home at the end of the day and I don't even feel like talking to anyone about it or just, I don't know, just letting it all out, I let it out through content. Yeah. So, what are the different methods or ways that people actually do self-harm? It includes cutting. Cutting is not the only method of self-harm. It includes hair pulling, head banging, and what else? Hitting as well. Oh, and burning. And there's many, many other acts of self-harm. What it is that you're gonna do it to cause intentional harm to yourself and self-harm. Okay, so oh my, so that's how the symptoms. We looked at the symptoms. We looked at how it is diagnosed. Remember, you have to have at least 5 of these symptoms. And for an endurance, a duration of time, and how is it treated? Well, basically, there's not one test that can diagnose borderline personality disorder, but they're gonna look at like your symptoms, gonna ask you questions about your symptoms and so forth. They're gonna look at your family history and also if any family member, have any mental illnesses in your family and things like that. And as I said in the introduction video, that borderline personality disorder is treatable with psychotherapy, even talk therapy, as well as approved medications. Right? So that is part 2. Yeah, we're going strong. We're gonna finish it. Okay, that's part 2. Look forward to part 3. Bye.